It's already a vaccination leader in Europe, and now Denmark is one of the first to promise a digital vaccine passport.
Julio Castañeda is flying to New York, and before he can board his flight, he has to prove that he's COVID-free.
You download the app on your phone, it has all your information.
This is AOK Pass, a digital health passport that verifies whether someone has tested negative for the coronavirus or gotten inoculated.
Clearly, we need to focus on reopening the economy as soon as possible.
And I'm hearing there's talk about a vaccine passport. What is that?
Yeah, so this is this kind of futuristic idea where we actually have a requirement to get a certificate of vaccination before we can do things.
It's pretty clear that vaccination certificates are moving forward. And given that, how do we do it right?
What if we were to be required to prove to employers, airlines, or sporting venues that we're immune to the virus?
Across the United States, businesses and schools are now trying to figure out what it will take to safely resume in-person operations.
As Max Massey shows us, some of the country's biggest tech firms and healthcare organizations are working together to help facilitate safe in-person activities.
The group, called the Vaccine Credential Initiative, wants to ensure that everyone has access to a secure digital record of their vaccination, like a digital vaccine passport, something that can be stored in people's smartphones. The record could be used for everything from air travel to even entering concert venues.
This is an Omega Watchman Media Group production.
Due to the mature nature of this content, language, and depth, viewer discretion is advised.
Efforts gain momentum worldwide. Tech companies and countries are now racing to develop a standard way to document vaccination status. In the UK, one company is already rolling out what are known as digital vaccine passports.
And it causes all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads.
Vaccine passports, a ticket to a life of foreign travel, nightlife and leisure, or a path to social exclusion. Governments and developers around the world are exploring whether vaccine passports, to identify those inoculated against the coronavirus, could help to reopen their economies. But those developing the technologies are urging lawmakers to think seriously about overcoming the obstacles to their use. Biometrics company iProve, together with cybersecurity firm Mvine, received UK government funding to develop a vaccine pass that is now being tested within Britain's National Health Service.
Well, ultimately, the border measures of other countries and what they require of people coming to their countries will be up to them. One of the things that we are seeing now is the UK is one of the leading countries in the world. Over 10.5 million people vaccinated, 20% of UK adults vaccinated. So we're seeing that our world-class vaccine program, receiving countries will set their own border measures. It will be up to those countries to define what they require travellers to have. At the moment, most countries, including our own, require a negative test result, and we'll have to see what countries, what the international community put in place once vaccines around the world are as effectively distributed as they are here in the UK.
Hey, Joe, good morning to you. You know, vaccination passports are nothing new. International travelers are probably familiar with this little yellow book. You've got to show proof of yellow fever vaccination, for example, if you want to visit some countries in Africa. The problem with these little papers is that they're not secure and they're pretty easy to forge. That's got governments, but also private companies scrambling to come up with a better solution. Today, we got an inside look at what one company in the north of England is trying. They're here. Digital vaccine passports are rolling out for healthcare workers in the north of England. It's the work of British company The Health Passport. What's the advantage of having this digitally? Why not just give everyone a piece of paper?
People are starting to sell fake COVID passports so they can go on airlines. They're using the V code because it is end-to-end secure. It ensures that none of these certificates, either paper or digital, can be forged.
Ladies and gentlemen, welcome. They're far from alone. IBM, Microsoft, even the Danish government are all working on their own versions of a digital vaccine passport to reopen borders and allow people to travel without quarantines.
We very much see this pandemic transforming the travel experience, similar to what 9/11 did with security. Health passports, proof of vaccination going forward is something that we really believe will be with us for some time.
IATA, the International Air Transport Association, which is piloting its own vaccine passport, says the biggest hurdle isn't the technology at all, but the lack of clear standards from governments and the World Health Organization.
The standards that we need in place, we needed them months ago. So, yeah, we need the pace to step up.
Now, guys, most of the industry folks that we spoke with said that until we actually know more about how the vaccine works, whether it prevents transmission or just severe infection, you can probably expect that you're going to need to show proof of a negative COVID test in addition to proof of vaccine in order to do any international traveling. They also told us the best guess is that this is weeks, not months, away from some airports. Joe, Savannah?
Wow, moving quickly. Sarah, thank you so much.
The town hall in Paris's 15th district. A new batch of COVID vaccines arrives. Inside, a doctor measures out doses ready for use. Elderly people are being prioritised for immunisation. Those here are hopeful that life may soon return to normal.
I'm just desperate to do things again. I feel like I've been stagnating and I couldn't wait to have this vaccine.
The goal is that everyone is vaccinated as fast as possible so the virus recedes.
As the number of people vaccinated against COVID in France grows, so does talk of a vaccine passport to travel. This French politician says such a document could also be used to visit restaurants or theatres.
Those who are vaccinated should be able to resume activities. The vaccination passport would show that a person is no longer in danger themselves and no longer a danger to others.
Supporters of a vaccine passport say it could help revive vital economic sectors like tourism. Paris is usually one of the world's most visited cities, but in the past year, few people have come to admire its monuments or enjoy attractions like this cruise. The owner of this boat tour company on the River Seine says he would welcome a vaccine passport if it would encourage international travellers to return to the city, because without them, it'll be a challenge to keep the business afloat.
Any solutions that can help us live normally again would be good. There are already countries that require vaccinations to enter, so a vaccine passport is a good idea if it can help everyone work again.
Opinion polls suggest that a majority of people in France support a vaccine passport for travel or access to certain services. But the French government says it's far too early to consider such a measure, that it would be divisive because not enough people have been immunised and many don't wish to be.
With coronavirus vaccines now rolling out across the United States, businesses and schools are now trying to figure out what it will take to safely resume in-person operations.
As Max Massey shows us, some of the country's biggest tech firms and healthcare organizations are working together to help facilitate safe in-person activities.
The group, called the Vaccine Credential Initiative, wants to ensure that everyone has access to a secure digital record of their vaccination, like a digital vaccine passport, something that can be stored in people's smartphones. The record could be used for everything from air travel to even entering concert venues. The coalition comprises a broad range of healthcare and tech leaders, including Microsoft, Salesforce, Oracle, Cerner, Cigna's Evernorth, healthcare software firm Epic, and the Mayo Clinic, among many others. Although it's early in the vaccination process, potential use cases of such a technology are already cropping up. Some companies plan to pay their workers to actually get vaccinated. Some experts expect that states and countries currently requiring negative COVID-19 test results for incoming travelers could eventually also accept these vaccination passports. Now, the Vaccine Credential Initiative wants to create an open source standard model for how hospitals, pharmacies, and clinics administer vaccines and how they make those digital records of the immunizations, which can be provided to patients who want them. Immunizations are typically tracked by writing them down on a piece of paper, a card for people to store with their important records, and are also kept track of in a patient's electronic medical records. For one thing, coronavirus vaccination records will be more easily accessible and easily transported if people have access to them for schools, offices, event venues, making a digital record even more practical. The COVID-19 vaccination record also needs to be verifiable and secure in a way that was less important for past vaccination records. Otherwise, a person could try to fake having gotten a COVID-19 vaccine by using someone else's record. The tech companies play a big role. Firms like Microsoft and Oracle, they manage the tech infrastructure for a lot of large healthcare systems, and they can build in the standards for a vaccine credentialing system, making sure accurate vaccine data pops up right to your smartphone.
It's already a vaccination leader in Europe, and now Denmark is one of the first to promise a digital vaccine passport. For these frontline workers, that could mean more freedom.
I think lots of people will use it, and for the world economy, it will be good, so we can move on.
It's a push to get life back to normal, the potential to open up travel, restaurants, even concerts for those who have been vaccinated.
It's an app that you can download.
IBM is pitching its technology, an app using a QR code that when scanned gives COVID information, including test results and vaccine status.
The more countries that will connect to a platform where this information can be shared, the more valuable the platform gets. But we need to start somewhere.
Concerns have been raised about privacy and that people who can't get a vaccine would be unable to return to normal life.
The drive here in Denmark mostly comes from business life and politicians.
This virologist also has public health concerns, not only because the vaccine doesn't give 100% immunity, but because of mutations.
There are these variants, and just a single introduction could be sufficient to cause serious harm to the Danish society. So I don't see that the passport can work on its own.
But for businesses, it can't come soon enough. The owner of this hot dog shop says he would happily check customers' passports if there were no restrictions at all.
Corona pandemic is very bad for business, for my business and for Denmark. We bleeding every day.
But for now, it's just a promise, then on detail, that the Danish government says should be up and running by the summer.
The total economic loss of COVID-19 in terms of GDP and health costs is estimated to be around $16 trillion, according to a study by 2 Harvard University professors. To put that in perspective, that is 90% of total GDP. Clearly, we need to focus on reopening the economy as soon as possible.
And I'm hearing there's talk about a vaccine passport. What is that?
Yeah, so this is this kind of futuristic idea where we actually have a requirement to get a certificate of vaccination before we can do things.
It's pretty clear that vaccination certificates are moving forward. And given that, how do we do it right?
What if we were to be required to prove to employers, airlines, or sporting venues that we're immune to the virus?
I think it's a little premature to be thinking and to be talking about how do we get people these immunization certificates.
The last thing you want to do is create further inequalities and make people feel like they really can't access the same things.
We have to be ready for this to happen in the future. And if we miss the window a little bit and don't make money off it or whatever the financial goal is, some way, shape, or form, we've all realized that this has got to be in place.
So what are vaccine verifications exactly? And can they speed up a return to normal? For herd immunity, between 58% and 94% of the population need to be immune. That means anywhere from 192 to 311 million Americans. As of mid-January 2021, nearly 10 million Americans have received at least their first dose of a COVID-19 vaccine.
While the vast majority of Americans believe that the vaccine is important to facilitate a return to normal life, nearly half plan to defer vaccination for 3 months or up to a year. And so this, I think, combined with the inherent challenge of manufacturing and distributing vaccines really threatens to slow progress towards herd immunity and ultimately to economic recovery.
That's where immunization verification passports or certificates could come in. Remember the yellow card immunization forms? In the age of a global pandemic, that could be a smartphone application or a QR code on paper.
If we can make it work with travel, I think it allows us to study the technology as well as the validation, as well as the confidence in privacy that will then allow us to think about how do we use this for other things. I don't think it's going to make, and I don't believe it's going to make social distancing and masking go away until we hit herd immunity. But I think it's this process of maybe we can reopen up things a little bit faster.
For nearly 5 years, Dakota Gruner has been advocating for digital IDs as a basic human need, especially in developing countries. She's currently on a WHO-sponsored working group for smart vaccination certificates. Over the course of 6 months, the group is hoping to establish global standards for these types of solutions.
This is a very complex multi-stakeholder effort. Obviously, they're trying to do this at an international level. But the idea is to do something, I think, quite similar to what we've done with ID 2020 certification, which is what are the specifications of a good digital ID solution, or in this case, a smart vaccination certificate, and how do we get to the point where there's almost a list of WHO recognized solutions. But we don't pretend that in the interim, some of these solutions aren't moving forward independently.
Dozens of startups, as well as major companies like Microsoft, Ticketmaster, Apple, and Google, have shown interest or are currently working on creating their version of an immunization certificate for COVID-19.
I think where we're at least on the technical side, is a bit of a Wild West. It's pretty clear that vaccination certificates are moving forward, and given that, how do we do it right? And how do we ensure that investment is made in the sort of greatest possible way? This is not the time to move fast and break things.
Onfido is one of the startups who jumped on the idea early. As an identity verification company with $200 million in funding, a vaccination app was a no-brainer.
So the first thing where we fit in is making sure that it is Kevin Trilley or Tala that is the person signing up for this service. And then there's a second step that says use the core service, book your travel in the case of SideHide or whatever. Then the third is being able to add a new piece that says embed your health status as part of that application, so it can be shared with the person that you're booking travel with. And then in the case of the other one with the employment, you'd sign up for the service, you'd declare your employment status, and then you'd have some health, testing status that you would update and maintain so you can come to the office on a regular basis.
The life cycle of a pandemic looks something like this. Right now, we're in the pandemic phase, meaning there's widespread human infection. Even with a vaccine, there's a lot we don't know. For example, the duration of immunity, or if asymptomatic transmission can happen despite vaccination. And more importantly, only about 3% of the US population has been immunized so far.
Our focus should be on getting people vaccinated. Once we get enough people vaccinated that we can actually we can leverage that vaccinated pool as something that we can use, that's when I think the immunization certificates become something we can talk about.
That should happen around the time 40 to 50% of the population have been vaccinated, according to LJ. Even then, it's an interim solution. If the pandemic turns endemic, meaning seasonally circulating in society, or we simply reach herd immunity, the use of verification solutions becomes pointless.
It could be a year, right? Depending on how slowly we eke up, and remember, if more people take vaccination, if we're staying below that 75% threshold, let's use that as a threshold, and that could change. If we hover below that, it takes that much longer to get up there, right? Because we've reduced infection enough such that less people are going to get sick, which is wonderful. But it also means that if people don't get vaccinated, we're going to be creeping to that level. So thank goodness we have that vaccine. The reason we're having this conversation is because we have a vaccine.
Vaccination records in the US are tracked by 61 independently run immunization information systems. According to the American Immunization Registry Association, they help public health authorities ensure that patients are administered a second dose and to monitor the safety and efficacy of the vaccines. Sharing data between state lines requires approval from the governor or a health officer, and very few have embraced vaccine apps so far.
The data in these systems are validated by the state health department, by the provider who vaccinated, so on and so forth. How do we connect that data with some form of digital ID that the patient can now carry with them?
Is it worthwhile to try and stretch our already stretched super thin public health resources? I'm not sure this is the right time and place to do that.
Collaboration between governments, private providers, and international stakeholders will be key in the success of immunization verifications. Onfido is based in the UK and submitted their product to the British government in the spring of 2020. Kevin says they're not focused on scale at the moment. This has to come out in stages.
There's a lot we have to figure out still about a system like this. So in a way, we're sort of innovating. And if we can impact 25% of the population this cycle, it's great. That's a huge impact of people that could go further into their worlds, in this really restricted world that we're in today.
While much of the app can be customized, privacy cannot. A poorly designed digital ID solution could become a surveillance tool.
Privacy is not a concern until it is a concern. So it must be architected into the system at the beginning. And the example I would say is, you don't need to tell me your first name, last name, your address, everything about yourself, and all of your testing data, and give that to everybody. You should just say, I'm good. And the way you know it's me is because I use my face to unlock my phone, to access that credential, to then send it to you. And then what's sent to you is just the status. If you can do it in that way, then privacy is protected.
As with anything that entails digitization and access, there are some equity concerns. For one, requiring that individuals are vaccinated to be able to participate is risky, especially for communities of color who are more skeptical of the vaccine.
The last thing those communities want is for Big Brother to be watching. The other thing is the intention may be to enable some people to go back to work, but is it seen as, well, if I don't get the vaccine or if I hesitate to the vaccine, will that cut my opportunities?
Another equity concern is regarding access to technology and high-speed internet. Some providers are working on making ID verifications on paper, a QR code embedded with information that can't be falsified.
What we design and build today is going to have longevity past this. This may have utility in routine immunization. This may have utility in a whole host of use cases outside of healthcare.
We should be leading the world on this problem. So I think we have a second opportunity here to come with technology and other systems where we can get back, and maybe the next one we're actually going to lead the world in the way
Scenes
to
like
handle
this may feel like a distant memory, but with coronavirus vaccines being rolled out in many countries, there's hopes a return to normality could be within sight. These digital documents could be key in making that happen. Vaccine passports that prove a person has been inoculated. The Danish government has launched a scheme in cooperation with business organizations in the country, which should go live in 3 to 4 months.
Men der også dele af det danske samfund, som har behov for at komme videre. Der et erhvervsliv.
There's hope such documents could help shuttered businesses reopen and ease travel restrictions, removing the need to quarantine for those who've had a jab. The European Commission is considering its own scheme, which could enable travel across the bloc this summer. But questions remain over how to regulate the passes and how personal data should be stored.
Task that, as a team, we set ourselves was, how can we produce a vaccine certificate which in the end only has 2 bits of information in it? One is, has this person been vaccinated? And the other is, what does this person look like? You really don't need to know anything else at all.
Many airlines back the plans, and the International Air Transport Association has developed its own digital travel pass, a mobile application that would hold proof of coronavirus tests or vaccines.
Julio Castañeda is flying to New York, and before he can board his flight, he has to prove that he's COVID-free.
You download the app on your phone, it has all your information.
This is AOK Pass, a digital health passport that verifies whether someone has tested negative for the coronavirus or gotten inoculated. It's also known as a vaccine passport and meant to be easier to use and more reliable than paper immunization cards.
Medical results often are not even printed in a way that it's easy to interpret. Our system can verify health records.
Since the pandemic has devastated the travel industry, airports in Rome, Paris, and Singapore, as well as airlines like JetBlue and United, are experimenting with similar apps. They will compete for a slice of the global market for travel health services and certifications, which AOK Pass estimates is worth nearly $20 billion. Travel industry experts say this type of digital health certificate could be a game changer, not just for tourism, but live events and schools. So here's how digital health passports work. Travelers who weren't able to take a COVID-19 test before departure at this airport in Rome can get swabbed at a testing site set up by the airport. While waiting for the result, passengers can download the AOK Pass app and input their personal information like their birthday and email address. Within 30 minutes, the result is available. If the traveler tests negative, the app creates a unique QR code that serves as proof.
The doctor's scanning like the QR code that says that you're negative and you're good to go.
At the airport in Rome, it has to be scanned at check-in and boarding.
I think this is the only way really right now to travel like safely without like risking contracting COVID.
Some, but not all, airlines and governments require proof of a negative test before a passenger is allowed to board a flight or enter a country. While testing and vaccinations reduce the risk of spreading the virus, they don't eliminate it.
In the setting of COVID-19, health information is beginning to be used in a transactional sense, much more than before.
Chester Drum is a doctor at the National University Hospital in Singapore and co-founded AOK Pass. He expects that in order for people to return to pre-pandemic life, they'll have to show proof of their health status.
Let me show you part of my medical record to get on an airplane. Let me show you that I've had a vaccination procedure in order to go to an event, for example.
This has also meant forgeries. For instance, last November, 7 people in Paris were arrested and charged with selling fake COVID-19 test results that cost as much as $360. Drum says the app fights counterfeiting using blockchain technology so that the test result and vaccination certificates are unique and linked to only one individual.
The remarkable thing about blockchain is once it's entered, you can't change it.
While blockchain-backed apps may prevent fakes, there could be data leaks.
They pose a variety of essential questions for the protection of data privacy and human rights.
Anna Badusky is a researcher who studies the ethical implication of digital health data.
Policymakers should require digital health passport providers to adopt appropriate technical and organizational measures to address potential data privacy invasive situations proactively.
Public health researchers have found that some people in India and Indonesia who tested positive and had their results disclosed were verbally attacked or socially excluded. In the US, the Centers for Disease Control and Prevention recommends that community leaders and public health officials maintain the confidentiality of test results to avoid social stigma. AOK Pass says it encrypts all personal health information and tries to keep to a minimum the data it collects on its users. The company also said it does not monetize data but has signed contracts with airports and airlines to develop and test the system. After nearly 10 months of testing, AOK Pass is scheduled to launch in all major Italian and French airports by the end of February. It will have to compete with other companies developing a similar tool. United and JetBlue are preparing to use an app developed by the World Economic Forum called the Common Pass, while IBM is creating a digital health pass using blockchain. Drum says figuring out the technical parts of the digital health passport were relatively easy, compared with making sure the app would be used along each step of the travel process.
What's hard is the coordinated process, starting with a laboratory in a different country, creating a foreign medical record, boarding an airline, another highly regulated industry, and then crossing an immigration gantry, which itself is regulated by the rules and regulations of a country different than where you got your health tests.
When Castañeda arrived in New York for a layover on his way to Dallas, he says airline staff didn't ask to see proof of his health status. The Rome Airport Authority said they're educating travelers about the app and plan to reach out to airlines.